To make a wiser decision, we need to understand what is happening when we are doing the back extension exercise. So let's grab the spine and do a bit of demo. When you're doing the back extension, you're going to be lying on your tummy. And so all that's happening is we're using these muscles here, the back muscles. We're also going to be using the glutes and the hamstrings a little bit to elevate the chest off the floor, as well as elevating the legs off the floor. Now we can do other variations of this where we just raise the legs or just raise the chest, but fundamentally we are doing an extension. And what an extension movement is in the lower back, and we have to understand this clearly, is that it is an increase of the natural lordosis. Understand, the spine is not straight in the lower back, or it should not be. We start with a natural position, which is a natural backward bending curve in the lumbar spine called the lordosis. And the purpose of a back extension exercise is to increase that curve in the lower back, as opposed to other exercises which are even worse than something like this, such as knee hugs or child's pose, which actually flex, forward bend the lumbar spine to eliminate that curve and straighten the spine up. If you've got a herniated disc in the lower back, there's a good chance it's in the last two segments of the lumbar spine. These are L4, L5, so this disc here, and L5, S1, the junction between the lumbar spine and the sacrum. And one of the important features of these herniated discs is that they will invariably occupy the space where the nerves come out. Now, just because you can see it more clearly, if we take a higher up segment, you can see this little yellow bit which represents the nerves. Now, these will go on in these two down here and become the sciatic nerve further down in the pelvis and then go down the leg. But we can irritate those nerves because the disc space is occupying this hole. We have a degree of stenosis. So if we take that hole that now already is a little bit blocked, not in a problematic way, but a little bit blocked, and then when we bend backwards, we see the hole gets a little bit smaller, maybe substantially smaller, and that is where we can get instant aggravation of the symptoms of either back pain, buttock pain, or sciatica. The second thing to note, it's not uncommon, especially at L5S1, which is the last segment of the lumbar spine, for us to get a little bit of instability associated with those injuries. Now, as you'll see on the spine here, when we're bending forwards and backwards, these joints, the vertebra, the green bones, are actually hinging forwards and backwards. There is no sliding or what's called shearing taking place. The shearing is when the vertebrae slide forwards and backwards, and this happens when we've lost integrity to the joint. Just like other joints where we injure a ligament or some of the cartilage, we find that the joint doesn't move in its normal way, and therefore it's not uncommon, particularly in the lumbar spine when we have disc herniations, for those segments to not move quite as well as they otherwise would like to. And that's why exercises like the Superman, but also stretches like the Cobra, can for some cause immediate sciatic aggravation.